Hi, listeners. This is a quick thank you for listening and for your ongoing support. If you're enjoying the program, please consider clicking the follow or subscribe button if you haven't done so already. It really helps us out. There's no better way to support us than doing that or sharing the show with a friend, colleague, family member, or any new or expecting parent in your life. It's totally appreciated. On with the show. Hi, I'm Sarah Trott, and welcome to the Fourth Trimester podcast. I'm a new mama, and this podcast is all about postpartum care for the first few months following birth, the time period also known as the fourth trimester. My postpartum doula, Esther Gallagher, is my co-host. She's a mother, grandmother, perinatal educator, birth and postpartum care provider. Fourth trimester care, our topic, is about the practical, emotional, and social support parents and baby require. And importantly, it helps set the tone for the continuing journey of parenting. Hi, I'm Sarah Trott, and welcome back to the Fourth Trimester podcast. We have a special guest today, Dr. Joanna Parga-Belinkie. She's a neonatologist, a board-certified lactation consultant, and the author of the book, The Baby Bonding Book, Connecting with Your Newborn. We're going to talk today about the blueprint for baby bonding. And Dr. Parga-Belinkie brings both medical expertise as well as wonderfully heartfelt guidance on how bonding with your baby isn't just a feel-good practice. It's a vital part of your baby's development. We will dive into practical, evidence-based tips for nurturing that early connection and explore how bonding lays a foundation for lifelong health. Welcome to the program, Dr. Joanna.
Thank you so much for having me.
Yeah, welcome. So I'm really excited to talk to you about this topic. You are also a mom of three. Is that right?
That's right. I have a 7-year-old, a 5-year-old, and a 1-year-old that I live with.
Okay. So you're a busy woman.
It keeps us very active. It's also fun. They're fun kids. And so it's a fun house.
Absolutely. Tell me more about you.
So, thank you for that introduction. I usually introduce myself as someone who kind of accidentally fell into medicine. I didn't come from a family of doctors, and so it wasn't until college that I became excited about pre-med classes and science and pursuing a career in medicine. And I have been bi-coastal, so I lived in New York City, I lived in Los Angeles, and now I live in Philadelphia with my family. So I've always been in urban environments and enjoy raising my children in the city. And I think that being a mom really changed how I am as a doctor, and particularly as a pediatrician and a baby doctor. And so I think a mom is a word that really does describe me a lot.
And when you're three kiddos, we were talking just a moment ago, you had three very different postpartum experiences.
Yeah, in a lot of ways, so this is important, I think. I had my first child at age 32. So I wasn't in my 20s. I was a little bit older, and it took me a long time to get pregnant. So I remember when I first started trying for my first kid, and I just kind of thought it would happen. I feel like you hear all of this, talk about like, make sure you don't get pregnant, especially if you're a woman who's like trying to establish your career. I was getting it from my family, and then I was trying to get pregnant, and it took 10 months. And I was really surprised by that. And it can take about a year to get pregnant, and so I was within what was considered a typical time frame. My expectations were different, right? And so it was hard for me. And then I had a lovely pregnancy, and it was the first baby, so a lot changed in how I was during the fourth trimester, but I felt young. I was excited. There were no other kids in the house, so this was me with the one child. And I was starting to put together some of the things I had learned in medical school and in my training and residency and applying them to my own child. So it was a really exciting time. And then fast forward to I was 38 years old in my last fourth trimester. And I felt like those 6 years made a difference. I spent, all of my 30s trying to get pregnant and having kids. Because then again, with my last child, it took me 20 months to get pregnant. So it was a long time. And as much as I really wanted this third baby and I was excited, my delivery was difficult. I wound up getting induced after term. I carried all my babies after term. And unfortunately for them and for me, their deliveries were right around the holidays. My oldest daughter is a Christmas baby and my youngest daughter is a New Year's baby. So
Okay.
planning my inductions was difficult. The induction itself for the third took longer than anticipated. After I delivered during the fourth trimester, it was a struggle to recover. I had a really long labor. Luckily, I was able to deliver vaginally. And I say luckily because that's how I delivered my first two. So if I were to get a C-section on my third, it just would have been very different than how I delivered my other two. And it took a toll. And then all of a sudden I had two young children in the house. They were 4 and 6 at the time. And I couldn't just be with baby. So it was a different kind of bonding. Add on top of that I've only ever had fall winter babies. My son in the middle was born in October. I got the flu when I was in my fourth trimester with my last kiddo. So it was very challenging. And then when I think about having more kids, I'm like, I'm not sure after that fourth trimester. And I think for all of them, though, they become a time when you're really trying to focus on this new relationship while you're also trying to heal and rediscover yourself and thinking about how your heart is expanding to incorporate this extra person. So they were always a joyful time, even when there were challenges. And at least by the third, I knew some of the challenges that my body was going to be going through, what the bleeding felt like, what the pain felt like, how I could help get my milk supply in and establish breastfeeding, because that was important to me with all three. And so I felt empowered in having had that past experience, but they were all different. And in some ways, my last was my hardest. So I don't think having gone through it multiple times makes it easier.
No, I don't think so. It's not like you get some kind of perfect experience because you've done it once before, because like the baby's different, you're different, your body is ever changing.
And
Right?
I think
So,
in so many
yeah.
ways, it makes you realize how much you can learn every time you do something, even if it's something you've done before. And I feel like I learn from each one of my children every day.
Same. Absolutely. And bonding is your passion, baby bonding and bonding with children. And so this passion must have been something that you have carried along through all of your experiences as well.
I love the newborn period, and not everybody does, right? I feel like some people listening probably are already turned off because they're like, oh no, I really don't like babies when they're that little. But I love that period in part because if you really think about it, relationships and how you're interacting with your baby starting on day one is sort of the foundation for their brain growth and development. So it's a really important period of their life because the human brain is just growing at a phenomenal speed during that first year. And it's setting itself up for how it's going to create neuronal pathways or networks of nerves and how they're going to communicate. And really, when you're able to take time out and give yourself permission to take time out and really get to know your baby and establish a relationship with them, and hopefully it will become a safe, stable, and nurturing relationship for them to grow, you're really setting up how they're going to react to others, how they're going to learn, what their potential for learning and experiencing the world will be as they grow up. And you're also setting them up to be more resilient, right? And face the world. And so I think for all of those reasons, it's such an incredible time. And here's the other thing is even if you don't like the newborn period, it goes by so fast. They change so much in that first year and they still change as they grow, but gosh, is it quick in that first year. And so I think even though it can be challenging, if you can bottle up sort of the joy and the moments of real connection, then you're setting up a good foundation for that relationship, which is a relationship you want to be one of the most important in your life as you get older and as they get older.
One of the things in that very early baby phase that I associate with bonding is sort of the classic advice around hold the baby on your chest and get that skin to skin contact really, really early. And, I know there's this like intense tiredness that parents have after birthing their baby. And so just holding your baby feels so good and it's so valuable. Why don't you talk a little bit about why those early days are so crucial for a baby's physical and neurological development and health, and also some of the practical things parents can do?
Yeah, you really only get around 6 weeks of the baby really just wanting to lie on your chest, like frog-legged on your chest and take like a big snooze, right? So it's, again, such a short period of time and it matters so much. And how do we know that, right? So I'm also a neonatologist, I'm a baby doctor, and I work in the neonatal intensive care unit. And in the neonatal intensive care unit, we take a lot of information from babies, right? And they're not your healthy term babies who go home with their parents right after delivery. You know, they are your sicker babies, right? And we also see a lot of babies who are born early or premature, right? And so what we do, though, is we have those babies on monitors where we're able to look at their vital signs. So we look at things like their heart rate, their breathing rate, or their respiratory rate, as we call it, and their oxygen saturation. So what their oxygen levels are. And we know that when babies are doing skin to skin, or what we call kangaroo care, because you can imagine like you put the baby in your shirt or close to your skin, right, where they're snuggled up against you, that it actually affects the baby's physiology. So we have premature babies that really have trouble controlling their heart rates or their breathing patterns, and because they're immature, and so there's some dysregulation there, and that goes away when a parent is holding them on their chest. All of those vital signs we talked about will stabilize, and it is an incredible thing to watch it happen in real time on the monitor. And so while we don't have that information for your healthy term babies, we can kind of extrapolate from that, right? And say, wow, like there's really something there where that kind of contact where a baby can feel your breathing and heart rate, it calms both the parent and the baby. It also likely affects hormonal release, right? And there are different hormones for calming and bonding. One of them we talk about a lot is oxytocin. So it's not just the baby, but it's also the person holding the baby that's going to have a response to being able to be that close to somebody else, right? And there's really good data in babies who are born and don't have to go to the NICU about something called the golden hour right after delivery. So that's when right after a baby is born, in that first hour of life, they go to the birth parent, and they usually go on the chest of the birth parent, kind of like we were describing with kangaroo care. And what that really helps is with breastfeeding. So we know that if that birth parent then wants to breastfeed, that's going to be a big stimulus for them starting to produce milk and be able to jumpstart their milk production. And so a lot of times too, babies will try to actually get to the nipple and try to breastfeed while they're on the chest in that first hour, right? So all of this to say that this kind of contact, it does help with bonding. It doesn't mean if you don't get it that you're not going to bond, right? We're just talking about that your contact as a loving, attentive caregiver, kind of from the moment the baby is born, is important. That's what we know. And that type of content and that type of contact and the consistency of it over time is what's going to be important in growing that baby's brain.
And so the baby is this a time, like if you miss that bonding, you can make up for it later?
Absolutely. Right. I don't want to say that bonding doesn't have effects, because it does, right? It's been studied and we know that has effects, but there are going to be challenges in birth, right? That you might not be able to anticipate happening. And if you miss out on that first golden hour, it's okay. There's going to be time later on for you to bond with baby. If breastfeeding is not something you want to do, breastfeeding is not the only way to bond with a baby, nor is it even, maybe the best way for some families to bond with their baby, right? So there's going to be a lot of other opportunity in the future to do that. So if you miss out on it early, that's okay. Just think about starting as early as you can, as early as is safe and healthy for both you and baby. And I think if you have that focus on it, that's what's important. And because a lot of times too, I have parents that don't feel that instant love for their baby after their baby is born. It's not a love at first sight thing for them. So it takes them time to start to really feel that deep love and connection. And I always say to families, that's okay. Because think about so many of the relationships in your life where you're meeting someone for the first time and you're getting to know them and you're establishing a relationship with them. They're almost never straightforward, right? And one thing about having a baby is you feel that parental duty to love and care for them a lot of the time, right? So in some ways, that's more straightforward than many other relationships you might have in your life. But I think it's about making that connection over time. And I think what's really helpful for families sometimes is not focusing on delivery and the birth itself, which people do with birth plans and other things, but thinking about that fourth trimester and sort of planning ahead for the goals you want to have and how you want to connect with baby, knowing that making a connection takes time. And so I really love the practice of a vision board to think about the things that matter to you, that you want to pass on to baby, that you want to start to model for baby, and realize how quickly that baby's brain is growing and how much they're going to start picking up on things that you're doing and how you're establishing that foundation.
Fourth trimester plan is absolutely something we recommend and talk about all the time on this show. We have a templated journal exercise to kind of go along with that. I love the idea of a vision board. It's so brilliant because you can get pictures and if you have a partner, your partner can get involved, right? Anyone who's supporting you, friends and family who are going to be there either at your birth or in the first handful of weeks or whenever, in that first year even, like bring them in and share that vision so that they can advocate for you and support you in the way that feels good to you so that they know. So we have a template with a journal exercise, like I mentioned, and it's questions around how you want to feel, what is practical things, emotional things. And just going through that exercise can be so valuable because you get to know yourself as well as get to know the other persons that may be involved in supporting you and all of that. That just goes a huge way in aligning on expectations before you're exhausted and at home with a newborn in your arms.
I feel like sometimes the birth parent feels like it all has to land on them a little bit. They have to be the ones doing everything. So I love what you're talking about, getting others involved, thinking about not only building a safe, stable, nurturing relationship with your newborn, but also surrounding yourself with those relationships. Because so much of child development is modeling what the parent does. So if your child sees your other relationships, right, that are healthy, that are sustaining you, that are supporting you, that's so important for them too. And really thinking about the relationships that matter when you have a child is so important because you're going to need to lean on those for support as your baby grows.
Yeah, 100%. So then after this golden hour, what are some other ways that you like to recommend for people to bond with their baby?
Yeah, I love this concept. So follow me here, that your baby considers you to be their favorite toy. And when I first heard that, I was a little bit like, hey, like I'm not a toy, I'm a person, I'm so much more than that. But I like the concept of it. And I think it's trying to say like you are enough. So you don't need fancy things that you buy off the baby registry or, to be following this like rigid plan for how to raise a child, right? You need to be yourself and you need to be loving and you need to give yourself time to learn this new human and find out the best way to support them. And so I think just knowing that you're enough and giving yourself permission to take time to get to know your baby are really important things when baby is born because we lived in such a fast-paced modern world. And there are simple things that you could do to start getting to know your baby. One of my favorite things to do with a baby is just sort of start to incorporate them in your day and talk to them about the daily tasks that you're doing that sometimes sound mundane. And sometimes you'll feel a little crazy doing it, but when you're folding the laundry, kind of describing that, who the laundry's for, why you're doing it. When you're loading and unloading the dishwasher, talking about that with baby, right? So that baby gets a sense of your voice, of your habits, of your routines. That is very stimulating for a baby. And that gets to doing other things like reading to your baby. So starting to read to them, again, they're not going to be able to see very much in the first few weeks of life. And it's not till around 6 to 8 weeks that they recognize faces and you get that amazing social smile that gets parents really going with bonding because they're like, now the baby's responding to me. But if you're talking to them early on and you're reading to them and you're engaging them, that's going to make that moment so much better because they're already starting to get to know you. And one of the best things you can do with a baby is something called serve and return, which is when the baby prompts you for an interaction, you're there to address what their concern might be. And a lot of times the way the baby does the prompting is by crying, right? And crying does not mean that you failed as a parent or that you were a bad parent or that you even did something wrong. Crying can just mean the baby's trying to communicate with you some sort of need. And that's the only way they know how to do it. So if you're there listening and you get it wrong, say they have a big poop and you didn't notice it for 20 minutes, right? So you're trying to feed them or put them in a different position, and then all of a sudden you smell it and you're like, wow, for the last 20 minutes they were crying and I didn't know that it was this poop, and then you change them and they're happy. That's actually great because you've kind of learned something there. And it's the trying that matters. It's the engagement. It's the attention. It's the, hey, like, I'm here for you and I want to get to know you. That really matters. It's not about getting it right, because relationships and bonding are messy. And then that's the other thing, I think I mentioned poop just to be playful, but really you want to play with them, and you can use all their different senses to play with them and take time out to play with them. And I think what makes that hard is sometimes it's kind of boring to play with a baby because until they get a little older, that serve and return is not mature, right? So it's like you're playing a tennis match and you're the only one hitting the ball over the net and you feel like it's not coming back to you. But if you practice play, if you make engaging them a part of your routine, they're going to start to hit that ball back and things are going to get a lot more interesting.
Yeah. So it's eye contact. I mean, the little things they can do too, just like raising their hand or making a sound or looking at you, like that is for sure serves over to you. So just looking back, right, and connecting in that way. Is that a return?
Definitely. One of my favorite things to do with my babies is when they would coo, I would coo back in the same way that they were cooing. So I've had parents be like thinking they have to, I was talking about talking, right? And making sure baby knows your voice, but you don't have to use words to do that. And so, and it became really cool. And you could see videos of this on the internet too, if you look at babies' videos. When you coo and when you coo back to them, they'll coo back to you. And then they could kind of get into a cooing conversation with you, which is really fun. And I have a 16-month-old now who's still learning words, but who's very expressive with her vocalizations. And so I just pretend that we're having a conversation. And sometimes I talk in her baby language to her, and it's just fun. And she knows that I'm trying to understand, even though I don't yet. And that is a real joy.
I mean, yeah. And it's so much fun too.
So much fun.
Yeah. Parenting doesn't come with a manual, but what if it came with a co-pilot? Meet Hello Gaia, the AI-powered parenting assistant that's always there for you when you need it most. From pregnancy to postpartum and as your child grows, Hello Gaia offers fast, reliable answers to your most pressing questions. What makes Hello Gaia different? It's built on trusted sources like the American Academy of Pediatrics and the CDC. No endless scrolling, no questionable advice, just the support you need when you need it. Hello Gaia works hand in hand with your care providers, serving as your 24/7 virtual partner on this incredible journey of parenthood. Endorsed by leading perinatal professionals, Hello Gaia is here to empower you, guide you, and remind you that you're never alone. Ready to parent with confidence? Say hello to Hello Gaia, your parenting co-pilot. Go to hellogaia.ai, that's HELLOGAIA.ai for your free account today. Hello Gaia, always here, always trusted. So then baby's crying. I want to go back to that point because it's such a good one. I think there's this misunderstanding that like crying, like a crying baby is like a good baby is a quiet baby. I'll say it that way. And actually, a crying baby is a communicating baby. That's really a positive thing, right? We don't want them to stop communicating.
No, you want them to let you know when they have a need, because that's how you start to interact with them. That's how you really get into that serve and return. And a crying baby is one that is trying to engage and how you respond, again, helps shape their brain. Let's get back to that, right? So responding to a crying baby is important. And remember, you might not be able to solve why they're crying. And sometimes they might just cry. We do a whole podcast episode on colic, right? And these fussy babies. And my first baby was colicky. And I almost sort of didn't know it at the time because I was living through it. And I just want to be real with parents that when your baby is crying and you can't figure it out, that can be really triggering. You could get really emotional about that. And that's okay. You're human and you want to try to respond to their need and you're not figuring out how to do it. And so sometimes that means that you need to take a break and step away. We're not talking babies are very demanding in that they need 24/7 care, and you're not going to be your most loving and attentive for 24 hours a day.
No, you got to
So
take care of yourself too.
you've got to
Yeah.
take care of yourself, and you've got to take breaks, and you've got to make it fun and find it playful, and you've got to get help if you're not finding it that way, right? Because then and get support and make sure you have a community around you that's going to support you and baby as baby grows. We can't do this alone, and I think so many people feel like they have to, but you shouldn't. We're humans, we're built on relationships and community. And so leaning into that when you have a baby is so important. But my first baby was very colicky. Every evening she had what was called the witching hour, where she would just cry uncontrollably for, I think, an hour. And I would go through this cry checklist I had of things we were talking about, changing her diaper, changing her position, offering her a pacifier. Really interestingly, my 2 older kids really loved pacifiers. My third, not interested in them. So I thought that was really, that threw me off as a third-time parent because I was so used to using and the name pacifier, a tool to pacify to help with crying. But my last baby was like, no, thank you. You need to think of other things. So making sure they're not hungry, doing all the things. But sometimes you get some babies that'll still cry. You'll have really tried to address all their needs, which is your job as a parent. Your job is not to make them necessarily stop crying, but it is to try to figure out and communicate with them how they're on the level that they're communicating with you. And I could never figure it out with her. So sometimes it would just be me walking around with her for over a half hour in the evenings as she cried. There's a lot of theories that colic is also that developing brain getting so stimulated during the day, particularly when that colic or that excessive crying happens at that witching hour, that they need, time for it to be calm, to be in a dark room, and they're getting ready maybe for sleep, right? And so that was kind of when I couldn't figure it out. I was just there for her a lot of the times when she was crying. And it helped me get to learn her. And she's always been more of a sensitive child than my other 3. And now that I know that about her. And so it helps me in the way that I parent her. But crying is just one of the many ways that a baby tells you how they're feeling. And what's really cool too is there's some research. I was in Los Angeles for a period of time and worked at UCLA, and there was a great researcher there that made an app that you could, by the tone and pitch of the cry, you could kind of figure out the basic category of sort of discomfort, pain, or hunger. And a lot of parents will describe that they know what each certain cry means for their child, which is pretty cool when you think about it, because it is really nonverbal.
Yeah, you get to know their face and their sounds when you're really learning that child.
Each one of my 3 children has a different temperament. And I don't think that my parenting style is that vastly different between all 3, but their different temperaments means that how I parent them has to be different, right? Because the things that they're going to respond to are different. My oldest is my most sensitive. My middle is my most wanting to show you how they're learning and expressive and extroverted. And I think the jury's a little still out on the 1-year-old, but she's very spirited and independent. So I think birth order might come into play a little bit there because she's had to be that in some respects. But her core personality is one of a very gregarious child. So we will see how that all pans out. But you definitely cannot be rigid in how you think of parenting each one of your kids.
Yeah. And they might respond to different ways of bonding differently too. And so we talked about the serve and return. That sounds universally applicable. What about parents who are in different situations, NICU or cesarean or other kinds of like birth trauma?
So I would say that if you wind up in the NICU or if you wind up with a delivery that you did not expect, give yourself the time and the space to grieve that and to process that. And grief takes time. So if something was really not as you expected, you might throughout that 4th trimester be dealing with that, and you might for years be dealing with that. And it's important to recognize how something has affected you and make sure you get help, especially for birthing parents right after delivery. Postpartum anxiety and depression are real things for which there are clinical treatments. And so making sure that you are taking care of your mental health after not getting what you expected out of a delivery or an immediate postpartum experience, it's so important to process those feelings and to be aware of them. And I think this brings up something you mentioned earlier, which is making sure that you have safe, stable, nurturing relationships that you can turn to when things don't go the way that you had planned. And particularly, we could take babies in the NICU as an example, because that's what I see a lot of. And a lot of times, those deliveries were emergent cesarean sections, which have precipitated some birth trauma. And adjusting to that can be so hard. And it can also be harder to be there for your baby when they're in the NICU. And so that's why when they do wind up there, we have social workers that are there to help assess mental health and to give resources to allow the family to be there as much as they can be. And I would say, too, that you can lean on other hospital supports like the bedside nurses and other people that are there. And that could be a little bit of some of that support that you can get from other relationships when you're in the hospital, because the NICU nurses in particular are there all the time for the baby and are helping you get to learn baby and are helping to take care of baby. And so that is really important to start to get to know them, especially if you anticipate that the stay will be a long one in the NICU, and also to allow yourself again to have that reflection on your mental health and start to regroup and think about the future you want to have when the baby no longer needs extra care in the hospital or what have you.
Yeah, I love that point. And it's okay to ask for help. It's okay to talk about what you're feeling. There's absolutely no shame whatsoever in getting the support you need if you're feeling that anxiety or other feelings that aren't your normal. So thank you for mentioning that. And then, I mean, it's kind of a balance. You're like, I'm balancing my own needs as well as bonding with my baby, or sometimes multiple babies if you have multiples. So do you have any practical tips or advice for support strategies around that?
Yes, I think when you have multiple children, and this could be you have twins, you have triplets, or you have older children in the house that are going to be siblings to this child, right? To make sure that you treat them all as individuals and that you make time for the other siblings as special time that you should announce and make a big deal about, because you want to make sure they know, especially if they're older, that you are making this time for them and that is important. And it doesn't have to be an hour. It can be 15 minutes. If I remember when my second baby was born, my first baby was 2 years old. And so she didn't know the difference between 15 minutes, a half hour, or an hour, so that was good for me, because I could take small pieces of really focused, attentive time on her, and she could take away and feel like my mommy really spent this time with me today. The other thing is not to blame the baby when you have older children. So when you can't give your attention to the older child and it's because of the baby, you almost want to do a little diversion and say, I just need 5 minutes. Mommy has to blow their nose, or I have to go to the bathroom, or I have to run in the kitchen, to allow it to not be the baby's fault that the other child is not getting that time. And I always say it's important to get the other children involved in the care of the baby too. So allow them to pick the baby's clothes if they're really young and can't help with other things, or show them how to change a diaper if they're older and why that's important and how they can do it for baby. Or if we talked about other ways to bond with baby by just talking and reading to them, get them involved in reading time, make reading time something you do together, and then talk up the baby. Again, can cry, right? And can communicate in some ways, but doesn't have language yet. So talk up the baby, and you can say that the baby feels certain things toward the older children that you might anticipate they will feel in the future, to help the older child know that they're developing their feelings, that they are also developing that relationship with baby, and that you want that relationship to be a positive one. And so you could really highlight those positive things for other kids. And having multiples is hard, right? Because they're all the same age. And so they all developmentally need the same things. But that's, again, getting back to making sure you make time for each one as an individual, because even twins are not going to be the same.
Yeah. There's a great book called Sibling Rivalry, which I love and I recommend. And one of the pieces of advice they have is around honoring uniqueness of each child. You don't love them the same or love them equally. I think that's really challenging because then it's competitive. But the idea of recognizing each kid as an individual and their uniqueness, and they're loved for who they are, because there's no one like them.
One of the scariest questions for a parent, who do you love more, me or my brother? And I get that now that I have a 7 and a 5-year-old, like, who do you love more? And I always tell them, I love you both with the same intensity, and I love different things about you in different ways. And then that lets me start to talk about the things I love in each child that are different. And I always tell them that my relationship with each one of you is different. So the things I love about you are different. And then I don't have to choose because I don't want to choose because I have a different connection with each one of them.
Yeah. Yeah. They're different humans, of course. So I know we've been chatting for a bit. I want to talk a little bit about feeding practices and how that impacts bonding, how feeding can help develop a deeper connection.
So you don't need to breastfeed your baby to bond with them. But the truth is, a baby eats around 8 to 12 times a day. So roughly they're eating probably every 2 to 3 to 4 hours during the day. So feeding a baby is just a big part of caring for a baby, and it can be exhausting no matter how you do it, whether it's with a bottle or whether it's at the chest. And it is time, though, spent with baby. So even though it can feel like a dominating practice with a newborn who is needing to eat and to grow and to thrive, it can also be a part of bonding. And again, it doesn't matter how you do it. It's just the time you put into it and the intention you put into it, and making sure you get help with it too. Because, I did breastfeed. Sometimes I loved it. I thought it was the greatest thing. I thought I was making this good connection, and it felt so good to be able to provide milk and nourishment for my growing babies. But sometimes I did not love it. It felt like a chore. It felt like I was tethered to the baby, and I felt a lot of pressure about doing it because I knew that breast milk was a very good nutrition for baby. And so but I put a lot of pressure on myself, and then it didn't feel good. It didn't feel like this amazing experience. And so I want to say that breastfeeding is not one thing, and it's not a panacea for bonding. It's not that. And I was very blessed to have a really great breastfeeding experience with my first two kids. So I felt like this is going to be easy with the third. I've done it twice. It went so well. I was able to juggle it with going back to work and making sure I was pumping. But then my third had a tongue tie that wasn't diagnosed until they were 4 months old. And that was with going to the pediatrician, seeing a lactation consultant, during those intervening months. But it wasn't until 4 months that the tongue tie got diagnosed. And it meant that, I had to really worry about her weight. I had to supplement her feeds and give her formula more early on. And I had to make sure that I was pumping after every time I was breastfeeding. And so while I had envisioned that my third time breastfeeding would be like over a year and it would be great, I was so experienced, my baby had other plans. That was not what her metabolism needed and what she really needed to grow. And so we didn't even make it to a year. We made it to 10 months of me giving her at least some breast milk and then also formula. And it really highlighted for me that feeding is not the only way to bond, and that sometimes it can be a stress more than it feels like bonding. But you get into a rhythm and you have to adjust to what your baby really needs to grow and thrive. And the important thing is that they're getting good nutrition to grow and thrive.
Mm-hmm. It's a great time to make eye contact and develop connection in that way. And that you can do that whether it's the breast or the bottle, either one. Rather than staring at your phone, you can look at your baby.
Yeah, it's a great time to have them on you, to have that physical contact, to be talking to them, to be singing to them. I actually used to, because I really love reading. And so when they were newborns, I really loved it because I could read to them the things that I wanted to read instead of the baby books. And so I don't know how much I want to admit this, but I got really into the Court of Thorn and Roses books by Sarah Mays. I don't know if you read them, but it is a very romantic-y series. And so my newborn, my last baby, is very in her subconscious. She must know a lot of romantasy. So we'll see how that pans out as she gets older. But it was a time for me to sit and read and be with her and just physically be with her and experience with her, which was wonderful.
And share your voice. Oh, that's lovely. Well, we have covered a lot of ground, especially for the parents who are listening. For the perinatal professionals who are listening, I would love to just ask you a little bit about how perinatal professionals can educate and support families around bonding in the NICU or just during early hospital stays and actionable tips for doulas and OBs and nurses?
I think the big thing is our healthcare system is a very problem-based one. And a lot of times it's not very nurturing and focused on connection. And we are in that system and we have to work within it. And especially when we're in a hospital, we can be a big part of that system. And sometimes we're viewed as a part of that system. And so I think one thing that we can strive to do is really make connections with our families. Because when we are caring for babies, we are not just caring for the baby, we are caring for the entire family in that hospitalization, the mother, the father, the extended family that's coming to visit, the siblings. And so when you ask about home life and other kids and favorite movies and what their profession is outside of the times they're coming to visit the hospital, that's what makes medicine more of a calling than a job. You can make a real connection and you could start to be a source of support for those families, because we all truly need support and relationships to hold each other up. And we can be, as healthcare professionals, one of those safe, stable, and nurturing relationships in the beginning of someone's bonding with their baby. And it will make you feel better and it will make them feel better. And I know that when I go into work every day in the NICU, or sometimes I work in the newborn nursery, I'm always asking myself, who can I connect with today? What connection can I make? And I can hope that that connection is going to be helpful for that family and their journey with their new human.
Thank you. Dr. Parga-Belinkie, where can we find more about you? Where can we learn more?
The baby bonding book you can get on the American Academy of Pediatrics publishing website. And you can also see videos that I do with healthychildren.org. And the only social media handle I really keep up is on Instagram at Jo Parga-Belinkie MD. So you can check me out there. I'll sometimes post about my kids and always post about any medical information or new podcasts that I'm doing. And I hope you do reach out and come find me, because I love to talk about anything baby.
Wonderful. And any final thoughts you want to leave us on the topic of bonding or anything else that's in your heart?
I just want to get back to the fact that you are enough, that your baby, when you give them loving attention, is going to grow their brain and it's going to set them up for the person that they're going to become later on. And so it's so important to take that time out and realize that you're enough and give yourself permission to just be with baby.
Beautiful. Thanks for being on the show, Joanna.
Thank you so much, Sarah. It was such a pleasure.
You can subscribe to this podcast in order to hear more from us. Thank you for listening, everyone, and I hope you'll join us next time on the fourth trimester. The theme music on this podcast was created by Sean Trott. Hear more at soundcloud.com/Sean Trott. Special thanks to my true loves, my husband Ben, daughter Penelope, and baby girl Evelyn. Don't forget to share the fourth trimester podcast with any new and expecting parents. I'm Sarah Trott. Goodbye for now.
Hello again, bicycle man. I know you're doing all that you can. I wrote the song, simple and true. I wrote the song, I'll sing a song for you. You got your wheels, you got your gears. You ride around town without any fear. You got your pedals, you got your brakes. You always wear your helmet for safety's sake. Hello again, bicycle man. I know you're doing all that you can. I wrote the song, simple and true. I wrote the song, I sing a song for you. Hello again, bicycle man. I know you're doing the best that you can. I wrote the song, simple and true. I wrote the song, I sing a song for you.